Hello friends. Acne is a very common condition which affects mostly teenagers, but any age group can be affected. And I'm sure a lot of us at some point of time have got acne. And the basic problem with acne is it causes a lot of social embarrassment. And it becomes such a big issue for a teenager, especially. And I guess nobody would like to have acne on their face. So let's try to understand what acne is and what are available treatment options. So acne happens because of overactivity of sebaceous glands in the skin, and one can have different types of acne. They can be comedonal acne, where you see small whiteheads or blackheads. The closed comedones are called whiteheads. The open comedones are called blackheads. Acne can be pustular, where you can have pus activity, in the acne. They can be painful as well. Then there is another variant of acne called nodulocystic variant, where you can have severe acne. And the major problem, the most dreadful complication of acne, that is scarring. There are a lot of chances of getting scarring because of this particular nodulocystic variant of acne. So, what is the common age group which is affected in acne? The commonest age group is obviously teenage. Usually, people get acne even like it starts at as early as 10 or 11 years of age, and then it can persist even till 40s or sometimes even later than that. So, acne is a physiological condition which happens because of the overactivity of the gland, and that's going to subside on its own even if we don't treat it at all. So, why do we need to treat acne? Basically, there are two reasons why we treat acne. One, acne don't look good on your face. You just don't like having acne on your face, and it leads to a lot of social embarrassment as well. So, secondly, acne can lead to scarring, a condition which is temporary, can disfigure your face forever. So, that is something which we don't want. So, that is the reason why we treat acne. So, coming to the treatment of acne, the most important aspect of treatment of acne is to understand the patient psychology, what's going on in their mind, their lifestyle, everything matters. Now, as far as treatments are concerned, we can broadly classify these treatments into two categories. One is non terminal treatment, and the other one is terminal treatment. So, as far as terminal treatment or permanent cure is concerned, there is a medicine called isotretinoin. This medicine dries up oil secreting glands in the skin, and it is really very helpful. Can reduce acne by not only reducing the oil secretion but by reducing the size of the glands permanently. Now, this medicine should only be consumed on prescription of a doctor, under supervision of a doctor. You can never have this medicine at your own. It has got serious complications. It should be used in patients who have severe form of acne, nodulocystic acne, which fail to respond to other medicines. This medicine should never be used as a drug of first choice. We have seen, a lot of over usage of this medicine over past few decades, which I think is not good. Then this medicine, one has to evaluate whether you can have this medicine or not. It's very important to understand this. Like there are some blood tests which we need to get done before the medicine. It can increase your lipid levels. It can affect your LFT also, liver function. So everything has to be evaluated properly while giving this medicine. The most important complication of the medicine is it's a teratogenic medicine, so can cause birth defects in female patients, like if they consume this medicine during their pregnancy. So one has to be very, very careful. The medicine can stay in your body even if you stop taking it for some time. So one has to be really, really very careful with this medicine. It can cause dryness of lips, it can cause dryness of your eyes. Sometimes people who have dry eyes or excess production of tears, they should avoid this medicine. Or the one who wears contact lenses, these people should avoid this medicine. Then it can cause body ache, muscle ache, it can cause sometimes a lot of pain, on especially people who are working out a lot should take lower doses of the medicine. Then the medicine can cause, in some patients, can cause increase in weight, in some patients even slight decrease in weight. So it is important to take this medicine under guidance of a dermatologist. Then coming to the non-terminal treatments. Non-terminal treatments include topical medicines like benzoyl peroxide preparations, topical retinoids like adapalene, retinoin. So a lot of medicines are there which we use for topical application. Topical antibiotics also like clindamycin, clarithromycin. So topical medicines can cause dryness of your skin. So once the skin becomes a little dry, that can be sometimes a dose limiting side effect of this medicine, and one has to apply a good amount of moisturizer or maybe use these medicines on alternate days to cut down on this side effect. Now, in patients who have severe scarring tendency, even if they get non-inflammatory acne or not that severe acne, sometimes they can have severe scarring. So in such patients, one has to think about giving isotretinoin even if they don't have nodulocystic acne. In some patients, people have to apply makeup like air hostesses, models. They have to continuously keep their face covered with makeup. Now in these patients also, it becomes important to, sometimes we have to give isotretinoin even if they don't have that much of acne, because the skin doesn't get time to recover. Another very important treatment, when we don't want to use isotretinoin and the patient fails to respond to the routine medications, this treatment comes really handy. This is called magic peel, and really it's a magic. We do salicylic acid peels, we do black peels. These peels are really, really very helpful. As you can see in these patients, when we did this treatment, there was amazing reduction, like unbelievable. You can see these patients, they had a severe form of acne and they were not responding to medicines, and just 2 or 3 sessions of salicylic acid peel, or there is a specific peel, just 2 sessions of Satya's magic peel did these wonders. So this peel consists of black peel, salicylic acid peel, and some other combinations which we prepare, and it really helps to reduce comedonal acne. It reduces inflammation, it reduces the frequency of eruption of new acne, and it also helps in reduction of spots to an extent. There is another condition called PCOD, polycystic ovarian disease, in female patients where they have hormonal imbalance which can lead to acne. So in such patients, it has to be evaluated properly, like one has to get an ultrasound done, some blood investigations done to know the underlying cause. And in these cases, treating their polycystic ovarian disease really helps to control acne. So besides that, there is one most important aspect of acne, that is your lifestyle. Your lifestyle can really has a huge impact on the severity of your acne. So having a healthy lifestyle, what do I mean by healthy lifestyle? Drink at least 2 liters of water per day, if not more. Then take good fiber rich diet, roughage rich diet that keeps your intestines clean. regular exercise at least for 15 to 20 minutes a day, and do take care of your happiness. Make it a point that you do meditation for some time, or you are indulged in activities which make you happy. Yoga, pranayam, definitely it helps. It really helps. So, I myself have suffered a lot because of acne. When I was in my school, I used to have a lot of acne all over, and I know how bad it feels to have acne on your face. I used to hide my face from people, and I used to take a lot of time to prepare myself to go out, and I think I became very shy because of this, and I still remember I used to avoid social outings because of this. So acne is something which is physiological. It happens at this age. It can be controlled, it can be treated, and there are so many medicines and treatments available these days. So if you feel your confidence is getting affected because of acne, nothing to be worried about. Just consult a good dermatologist nearby, and you can really take care of this small problem very easily, comfortably, conveniently. So all you have to do is just consult a good dermatologist, and he'll take care of the rest. Thank you. Love yourself. Stay blessed. In case you want more information, you have questions regarding this, you can ask in the comment section, or you can call us at the given numbers. You can mail to us at the mail ID given. You can, if you like the content of the video, please press like button. You can also subscribe the channel for more such information. Thank you. Love yourself. Stay blessed.